Well, George, thanks. You are so nice, too much. And in fact, I thought you are talking about somebody else, but me, myself, is Masao Omata. And I just may give 5 minutes talk. And in fact, with all these awards, I really appreciate the Justin Wu and other members of the federations and the APDWF. These are the names. And in fact, I know most of them because I've been around in this area for so long. And especially I thank for the Kel Fok, and Kel Go, because from the very beginning, I was deeply influenced with the people who run this area for such a long time. And I can name 100,000, but I only picked a dozen here. And how I was involved with this federation is maybe Kel Go said that Skelam is the one who started. And I was involved since 2004 until 2021, so 18 years. What I have done is try to join Apostle and the other GI people. So that's the only thing maybe I've done. And today I touch a little bit upon myself. Well, I was born just after the World War II, so I'm going to be 80 years old. And I want to be Otani when I was a child. But because my mother was a daughter of the doctor, private practice, so I got to be a doctor. I was forced to be a doctor. And then even in summer, I want to go to swimming, but rather I have to study. And I went to the Chiba University. But that was a time that there's a lot of student protest. So I only went 2 years to the medical school. Then after graduations, I joined the department of Okuda. Okuda took the chair in 1970. I joined the department. We are the first group to join his department. I think he taught me, you got to change the scale, and also you got to know the diversity. Well, diversity, I think this federation is real one, but so I wanted to go to the Bob Peters' place because Okuda just started to write a first book on hepatocellular carcinoma with Bob Peters, but Bob Peters said, you got to do general pathology at the beginning. So I went to the States and then took the training of general pathology. I still remember when on the way to the United States, guy sitting beside me is a Vietnam War veterans because that's the end of the Vietnam War. Then I went to the Yale, but you know, I only went to 2 years of medical school, and I'm not a native speaker, and I'm not a Caucasian, so I had a hard time, but I survived. And then at the third year as a chief resident, I was able to spend 10 months in his particular office of the Klaskin, because Klaskin used to have a very nice collection of the liver biopsy with the history attached. I really wanted to do the liver pathology, so I took get my kicks on Route 66 by Firebird from New Haven to Los Angeles. And then Los Angeles was a dream. 4,000 liver biopsy in a year. And then there was also the Edmondson. Hugh Edmondson was still alive. So I really enjoyed these 3 years in University of Southern Cal. But Okuda called me back. And so I have to return to the Japan. But during that time, I was able to be involved in some of the cases just George mentioned about. And then especially, I started my study on HBV 50 years ago. It turned out that 60 years ago, the Bramberg discovered. So maybe I realized that only 10 years later, I started my study on HBV. Okuda bring me back to Japan, but I realized I tried to apply this liver pathology to clinical diagnosis, but it turned out MRI, CT already, US already developed. So I thought, how can I spend such a time 6 years in the States. Then I heard the term like ACGT. What's about ACGT? I asked Okuda. Okuda was a biochemist. He spent 10 years at the Hopkins being as associate professor of the biochemistry. He didn't know that. So then I realized, oh, maybe this is it. Then we started the molecular biology of the small virus. So I went back to the Fox Chase Cancer Institute. There, Blumberg, not just Blumberg, but there is a Bill Mason and Jesse Summers there. So we studied the molecular biology of human and then dark hepatitis B virus. One of the studies that we demonstrated was this one that George mentioned, closed circular viral DNA. And this is still the target, and we can get rid of it yet, even after 40 years. So then 1991, we published 2 papers. One is on the fulminant hepatitis. It's called the precoa mutant. How I discover? I discover because I lost my mother. This 64-year-old female is my mother. I couldn't cure my mother, even though I started my study on HBV. Then, on the same year, those days we call non-A, non-B hepatitis. And then if you follow a patient transfused, 80% get chronicity. But during that time, ctDNA discovered. So we set up the PCR assays, and then we gave very short period of time, or the 4-week interference, and then I was stunned that everybody cured. 10 years after, 2001, Michael Mann's group also reported similar data in New England on the drug users. So by this, we realized, okay, maybe we can cure the hepatitis C, but it turned out it was very difficult because only 10% cured by the interference. Since 1992, I was called upon to University of Tokyo. I spent 17 years. Very exciting, wonderful time. I had many young doctors with me, and then, for example, like Sheena did a lot of treatment for hepatocellular carcinoma. And then there is one surgeon, God Hand Makuuchi, there. So we are sort of, not really battling, but thinking about the patient, which is better. So we thought we are better. But it turned out at the end, we treated 1,000 cases a year, which is maybe the highest, one of the highest throughput medical center. And also, not just the liver, I tried to expand my department. I offered my papilla because I got, the stones. And then I offered my papilla, and my younger colleagues, like several names I can mention, but after ERCP, I got serum aminase went up to 4,000. But anyhow, by doing that, I tried to expand. And this is the last grand rounds with Fuji, my chairman, Fujishiro Sensei behind. And the patient is Mr. Kawasaki. Fujishiro Sensei treating the Kawasaki. Kawasaki, maybe some of the pediatricians may know the names. It's a Kawasaki disease. He named that. But anyhow, by saying goodbye to the many wonderful, excellent fellows, and many of them are in this meeting, I think. Then I went to my home country, because Chiba is the east of Tokyo, and then I went to Westbound. Still further, I went to Yamanashi. Yamanashi is an area west of Tokyo, and then actually I was born there in Yamanashi, so I went back to the homeland. Governor asked me to run the hospital. So then 16 years passed, amazing. Then what I have done is that very simple, working like a monk, like from 7:30 till 9 p.m. for 16 years. And if you take a look at the map of the Japan, many of the liver disease are in western part of Japan, but except Yamanashi area. The reason is why we have so many hepatocellular carcinoma in the area is we used to have Schistosomiasis japonica. Schistosomiasis japonica is not the one who produces cancer. Fibrosis, yes, but because of the treatment, still now, people use the injections, intravenous injection. So that spread it, the HCV. So that's sort of endemic area. So I got in there and then tried to reduce the cancer there. After 16 years, it turned out the average occurrence of cancer used to maybe higher than the average, 13.6 versus 16.2. But now, after we published several papers by the registration trial, then we started the year 2013, 14, 15, and then now it's almost average. In 2012, we put a small article in the Nature Review Gastro by Dr. Tateishi together. And what I say? Well, maybe we need a big step forward because year 1982, I studied the molecular biology of virus, but the size is not that big, 3,000 nucleotides. Maybe after 30 years, we may have to challenge the bigger ones, like human genomes. And then that's the time that everything, started. So that now we can tackle with this big genomes. So at this moment, our hospital is 150 years old, 900 beds, and then I established a genome analysis center 2013. And there are so many things. I got to be responsible for finance. I got to take care of the young doctors, and also my biggest concern now is stage 4 neoplasma. I think this is the one that people are waiting. The thing we have done is a prevention, a cure, to find the tumor small, but certainly there are many patients who are suffering with the advanced stages. So I spend 19 or 16 hours a day, but the weekend I go back to my house and then can maybe enjoy or annoying sometimes. And also, weekend, I have to see my wife. And then this is, I think, the one we took 7 years ago, that with Mrs. Eskelam and George. The reason is very simple. Wife of the George Lau, Vanessa, is having the same birthday as myself. So we had a wonderful birthday party in Hong Kong 6-7 years ago. Thank you very much. I really appreciate for your, I couldn't appreciate enough for exchange of knowledge and your friendship for such a long time. Thank you very much.